Now I will move to the main imaging features of CADASIL. I will do this talk with my colleague Marco During. We are working very closely together with our cohort data, trying to better understand the pathophysiology and the connection between MRI markers and the clinical features of the disorder. Perhaps, can you decrease the light, please? Yes. You can see here the typical presentation of CADASIL patients. Here, T1 weighted images and these small lacunar infarctions. Here, T2 or flare images with the diffuse and widespread white matter lesions. And in a significant proportion of patients, we can detect in CADASIL hypo-intense lesions typical of what we call microbleeds in patients. We have shown a long time ago that there was a huge age effect on the development of lesions in CADASIL patients, and that nearly more than 80% of patients of age higher than 55 present with widespread confluent lesions in CADASIL. You can see here the white matter lesions of a subject who was 20 years of age, who had no symptom. This one was 30 years of age. He had a history of migraine with aura. This other had a stroke and was 40 years of age. This one, 50 years of age with some cognitive impairment. And this one was a patient from Lille. And she presented with a history of cognitive impairment without any stroke. And the diagnosis was unknown at this time. All these patients have CADASIL, and you can see here the progression, the potential progression of white matter hyperintensities. An important feature of the disorder is the location of these hyperintensities in the temporal lobes of patients. And this typical aspect is present and with large white matter hyperintensities in 2/3 of patients, according to this first study performed by the German group. It is now possible to delineate precisely all the lacunar infarctions observed in CADASIL patients, and with Marco, we are able now to provide a map of the most frequent lacunar infarctions in CADASIL, and you can see that these lacunar infarctions are mainly observed in the deepest part of the brain, in the brainstem, and in basal ganglia, in the thalamus, and quite less in the white matter. We showed with Dominique Hervé in a paper that we published in Stroke that the volume of these lacunar infarction is probably different in white matter and gray matter, with larger lesions observed in white matter than in gray matter in CADASIL patients. And we also reported with Eric Jouvin using a post-mortem data provided by the team of Françoise Gray in our hospital, that we can detect in CADASIL probably a small infarction located in within the cortex of these patients. In association with a small infarction, we can see microbleeds. You can see here microbleeds detected in the white matter as hypointense lesion on T2 star images within the brainstem, or here also, which is interesting, within the cerebellum. About 1/3 of patients with CADASIL present with microbleeds on MRI examination. And with Anant Viswanathan, we tried to better understand the distribution of these white matter, of these microbleeds within the brain. And we showed that the distribution differed from that of lacunar infarct or from that of T2 hyperintensities. And particularly, for example, we saw multiple microbleeds in the cerebellum where we never see ischemic lesions in CADASIL patients. And with ANOT, we were able to show in a large series of patients that these microbleeds were associated with the level of systolic blood pressure, even in subjects with normal blood pressure, and that hemoglobin A1C, the amount of lacunar lesions and age were also associated with the amount of microbleeds in the brain of CADASIL patients. A long time ago, I used diffusion, trying to better understand the loss of structural integrity within the white matter of these patients. You know that diffusion is related to the random movements of water, and the idea was that we should lose these, with the loss of the restricting membranes, we should see an increase of water movements within the tissue of CADASIL patients. And we clearly observed that there was an increase of diffusion within white matter hyperintensities in CADASIL patients. And there was also a loss of the orientation of these movements when we used anisotropy maps. And we showed that not only this diffusion was increased within the hyperintensities on T2 MRI, but that it was possible to detect abnormal diffusion outside visible lesions in CADASIL patients. You can see here the progression of a diffusion after 1 year and another year in a single patient, and which means that under the white matter hyperintensities, it is possible to detect structural changes within the tissue using this method. I told you before that this is a frequent feature of patients, but this is often associated with dilated perivascular spaces. And you can see here on FLAIR images a typical feature of CADASIL with not only hyperintense lesions on thin slices of FLAIR images, but also the presence of hypointensities between the cortex and the subcortical white matter. And we have now pathological data showing that this is related to dilated perivascular spaces. This is a very useful thing for the diagnosis of CADASIL with a high specificity. We have recently performed a specific evaluation of these dilated perivascular spaces with grading of T1 weighted images. You can see here the grade of dilated perivascular spaces, the grading of dilated perivascular spaces in basal ganglia in our data. And we were able to show that the severity of dilated perivascular spaces in basal ganglia was associated with increased diastolic blood pressure in our cohort, and also that the severity of dilated perivascular spaces within the temporal lobes was strongly associated with the extent of white matter lesions, in contrast with dilated perivascular spaces observed within basal ganglia. The important question with these different markers is to determine the clinical relevance of these markers in clinical practice, and we try to work on this aspect with different colleagues. For this, we have measurements of different parameters with millimetric measurements of white matter lesions. We measured the brain volume, the volume of lacunar infunctions. We measured diffusion. And we did that with colleagues from the German group over several years and to obtain original data. And the first thing that I would say is that extensive white matter hyperintensities without infarcts can be observed in a significant proportion of patients. Sometimes white matter lesions can be very diffuse without any infarction in the brain. And what we observed is that this was also not completely related to age. You can see here the extent of white matter lesions in a 45-year-old patient, and here a 48-year-old person with much more diffuse white matter lesions. The amount of this lesion observed at 45 years of age was similar to the amount of lesions observed in this 69-year-old patient. And you see here the large variations observed within the patients. But if you look very carefully, I come back to this. If you look very carefully, we were impressed by the volume of ventricles in the presence of few white matter lesions. And you can see here the reduction of the volume of ventricles with the presence of diffuse white matter lesions. That's why we performed an analysis to take into account for all types of lesions, and we demonstrated that the normalized volume of white matter hyperintensities was in fact associated with an increase of the brain volume in CADASIL patients and not a decrease of brain volume. With Sarah Benisti, we were also interested by the clinical consequences of only white matter lesions in the brain, and we showed in a large study that the extent of white matter hyperintensities is associated with reduced performances in different tests, the conception subscore, the TMT verbal fluency. Well, in general, there is an association between the extent of white matter lesions and executive dysfunction in CADASIL. However, all patients, whatever the age, who have only white matter lesions are not demented, and all of them are an MMSE score more than 4, a Rankin score less than 3, and a Barthel score more than 90. Which means that white matter lesions alone cannot cause the severe disability in this disorder. You can see here a study that we performed with Eric Jouvin from our group, trying to link the amount of lacunar infarctions and the brain volume. And clearly, you can see here the same amount of white matter lesions, but here lacunar infarctions and here no lacunar infarctions. And we showed that the volume of lacunar infarctions with a mean of diffusion and age was explaining 46% of the variance of the brain volume in CADASIL patients. And therefore, after that, because of these different markers, white matter hyperintensities, lacunar infarctions, microhemorrhages, diffusion, brain atrophy, with ANOT, we thought that it would be interesting to determine which of these markers are the most related with CADASIL, with a disability in CADASIL patients. And we showed that the brain volume was explaining 40% of the variance of the cognitive decline in CADASIL. And there was also some effects of lacunar infarctions, but I would say in general, the brain volume and the volume of lacunar infarctions is clearly related to the clinical severity in the disorder. You can see here a study performed with Mike Sullivan, who was at this time in the group of Martin Dischgans, and who also evaluated the hippocampal volume in our patients. And you can see clearly that you can also observe a severe hippocampal atrophy in this patient occurring with the progression of the disorder. We further explore the relationship between brain atrophy, cortical atrophy, and the development of subcortical lesions in CADASIL patients. And we for that, we use new techniques to obtain the morphological features of sulci in CADASIL patients. And we showed that the morphology of the cortex was changing, and that these changing were strongly associated with the volume of lacunar infunctions observed at the subcortical level. And we were able to show also that there is now an association between some symptoms of CADASIL and cortical morphological changes observed in the brain of these patients. You can see here the association between the morphological features of some cortical sulci in CADASIL patients and apathy, which is a key symptom of the disorder. This is possibly related to important changes occurring within the cortex, and with the team of Françoise Gray, we showed that there was an important apoptosis of neurons that we can detect in some layers of the cortex, probably in association with the accumulation of subcortical lesion in this disorder. I would conclude telling that in CADASIL, white matter hyperintensities are associated with increased brain volume and executive dysfunction, but is not, these white matter hyperintensities are not associated with disability and dementia. Lacunar infarctions are associated with accelerated atrophy and correlate with cognitive impairment, dementia, and disability, and that there are major morphological cortical changes related to subcortical lesions, which appear with the progression of the disorder in CADASIL patients. Thank you. I give the